Hey guys, this is Dr. Greg with Medical Muscle. I want to talk about my experience so far with Psychiatry Residency. I have to say that I'm a very happy resident. I'm glad that I picked this specialty. Some days have been very hard, but in general, it's been a great experience. So for the first month, I was an inpatient. All of us were an inpatient, all the first year PGY1s. The main reason we're all in the inpatient together is to understand the protocol of how the inpatient works, what the attendings want, how to do very important legal documents. We would get in like anywhere between 7 and 7:30. Usually I'd be in there like 7:15. Chart check the patient, try to go see a few of them before morning report at 8:30. 8:30 to 9:30 is morning report. At 9:30, I'm trying to see my patients and see all of them. And then I have to go present the patients to the attendings, and I have to do all of this before we have our afternoon lectures. Usually we'll have a lecture from 2 to 3, and then Prite review or some other topic from 3 to 4. So that's 2 hours every day, pretty much. So if you are not able to get all your notes done, or even some of them before that cutoff time of 2 o'clock, then that means you have to stay past 4 and keep working. My first couple weeks, I was staying till 6, 7, 8. It was such a shock to get that much work done in that amount of time. All of us were having 8, 9, 10 patients. Our cap is 12, but we were pretty close because the unit was just really full. But the best part, especially about psychiatry, it's just a blast every time I'm there. Every day I go in, I actually look forward to my day. It's always interesting. The patients are amazing, sometimes so pleasant, so easygoing. They're just struggling with their own situation. But I really enjoy being in the unit. So even though I'm putting in those hours between 12 hours, it's still totally worth it, totally fun. And the nice thing is, as the month went on and I got more efficient, I'd get out at 4. I'd get out right when I needed to. I'd have all my notes done and everything. Our call schedule is once a month. We have to work Saturday and Sunday, 7 a.m. to 7 p.m. We're the only resident on duty, which is kind of scary the first day. You're the only resident. For the most part, you're covering the whole unit, and you see any new patients, anybody that comes in. If there's any emergencies, like someone gets restrained, you're the one that has to go and check on them. It can be quite overwhelming when your phone is going off constantly and you have 30 patients to go see and write notes on and go and meet like 7 new patients, right? But it's kind of cool because you're the only resident there and you really get to learn a lot. You get to see a lot, you get to talk to a lot of patients. It really shows you how to be efficient with your time. So I've had 2 of those shifts so far. The last 2 months, I've been in neurology, studying for step 3, currently studying for step 3. Neurology is really a cool specialty. I personally wouldn't have wanted, I'm glad I did psych rather than neurology, but I can appreciate it. It's really complex. It's a very specific type of medicine, because you're dealing with strokes, epilepsy, brain tumors. It's very interesting. The reason why we have to rotate in neurology is because our Pride exam that all the psychiatrists have to take has a good chunk of neuro in it. A lot more than UWorld or like step exams have. So it's kind of humbling to go back through neuro and trying to understand this material. When I was in medical school, I actually was pretty good at neuro, but I forgot everything. So in neuro, I'm studying for step 3 right now. I'm trying to get as many questions as I can before I take the exam. I think I'm exceptionally lucky. In this residency, our neuro rotation is pretty light. So I really have taken this opportunity to get my studying done. That's basically the first 3 months of residency. It's been a pretty great experience so far. I'm very happy. I get step 3 in 2 weeks. I'll let you guys know how that goes. And yeah, I wish you guys the best of luck.